Welcome, my name is Riley Hammond and I'll be doing oral medication administration for our lab. Okay, so I'm going to come to the med cart and I'm going to grab a cloth, piece of paper towel, give it a wipe off, getting rid of the debris, going ahead and hand sanitizing here, applying liberally. Okay, I'm coming to the MAR and I see my patient is Joe Milton. Risperidone, 2 mgs at 8 a.m. Yep, it's 8 a.m. So I'm going to go ahead and find his risperidone. Pulling it out, first check. Patient, Joe Milton, risperidone, 2 mgs, 1 tablet. So I've got the right stuff. So we're good there. Next, I'm going to go ahead and gather some supplies. So I'm going to grab a cup for water as well as my med cup for my patient when I head to his room. At this point, I'm going to go ahead and go through the 10 rights as it relates to medication administration. So to start, we've got the right patient, Joe Milton, right? He has the right to education about the medication that we're going to be giving him today. We've got the right assessment and reason for why he's going to be taking it. Maybe he has a psychiatric condition that requires risperidone to treat. As well, he has the right to refuse his medication if he should so choose. We next have the right medication. We have risperidone. We have the right dose, 2 milligrams, and we have the right route, oral administration, and time and frequency, morning and evening. Good. So we have then the right evaluation, or what we can do to follow is follow up on medication side effects or interactions, that kind of thing. As well, then we'll have the right documentation to follow. Good. So I'm going to go ahead and perform my second check as I'm about to transfer the pill into the cup, or the lid rather. So again, risperidone, 2 mgs, and our patient, Joe Milton. Right on. Okay, so he's got 1 tablet, so I'm going to be making no calculation is really necessary, as I know that my risperidone is 2 mgs. So I'll be doing 1 tab of risperidone. Okay, placing that into the lid, and then from here into the med cup. Nice. Go ahead and set that there. And as I go ahead and put this away, I'm going to perform my last medication check. So again, patient Joe Milton, risperidone, 2 mgs. So there we are, 3 checks. I'm going to go ahead and put that back in his box, lock it up. And if I had any questions about this medication, I would refer to a drug manual, but today we don't have any issues with risperidone, so we're going to go ahead and keep carrying on. I'll fill up my cup with some water. I'll make my way over to his room with the medication. As I enter the room again, I'm going to hand sanitize, apply liberally. There we go. And then I'm going to enter the room. Hi, Joe Milton. How are you doing? Can you give me your full name, rather? I guess I shouldn't have led with his name, but I would ask him for his name. Can you tell me your full name, Mr. Milton? Joe Milton. Do you have a date of birth that you can let me know as well? Great, and I'll go ahead and check the wristband to confirm with the MAR. So at that point then, I'm going to ask him if he's got any questions, if he's still liking to take the medication today, and he is, and he hasn't got any questions, so we're going to go ahead and give him his cup and glass of water. He'll finish with that, and we'll dispose the cup into the receptacle. I'll ask him if he's got any more questions, remind him that I'll come back and check up on him in a little bit of time just to make sure he's doing well, and yeah, just to encourage him to provide me with feedback that's helpful. So at that point then I'm going to give my hands a sanitize on the way out. I'm going to head back to the med cart, and here we are at risperidone, 8 a.m. So I'm going to go ahead and give that an initial to sign off on that medication has been administered. Thanks for watching.